The patient was brought in for a well-being checkup after her mother passed away. At the time of admittance, she reported having symptoms of noticeable negative changes to her eating and sleeping patterns, a very short temper, with a lack of interest in most or all aspects of her life, especially in school sports. She expressed significant mental turmoil, including guilt and suicidal thoughts, and showed an inability to focus or become motivated. She claimed to have physical pain without any observed injury. Antidepressants were prescribed to the patient for treatment, and she was referred to a psychologist. She was hospitalized 1 week later when her psychologist reported that she admitted to attempting suicide due to the persistence of her previous symptoms. After determining the antidepressants were ineffective, she was scheduled for a vigorous 6-week transcranial magnetic stimulation treatment program. She remained in the hospital for the first 3 weeks of treatment, given stronger atypical antidepressants alongside the treatment and therapy. Once improvement was made, she was allowed to leave the hospital and just come back for the TMS treatments and medication. The patient was weaned off of medication for a 6-month period while continuing psychotherapy. The patient returned to her stable mental condition. Clinical depression is a mental disorder characterized by overwhelming feelings of sadness and despair, often accompanied by reduced energy and avoidance of all social contacts. While depression can be the result of a traumatic experience or a toxic environment, it has also been found to be genetic and can be found in patients whose family members have depression. It also may just be an imbalance of hormones, often occurring in adolescence and early childhood. Patients may experience noticeable negative changes to their eating and sleeping patterns. They also may become very short-tempered while also becoming uninterested in most or all aspects of their lives. Patients go through significant mental turmoil, including guilt and suicidal thoughts, and show an inability to focus or become motivated. This may also manifest in physical pain without injury. Although a primary care doctor can provide treatment, patients may be directed to professionals that specialize in dealing with depression. A psychiatrist can prescribe medicine that will relieve symptoms, while a psychologist can provide therapy and counseling. Antidepressants can also be used to combat depression, and there are several different types. Selective serotonin reuptake inhibitors like Celexa and Prozac are usually tried first and have minimal side effects. There are also serotonin norepinephrine reuptake inhibitors like Cymbalta and norepinephrine dopamine reuptake like alpenzin, and are also an option for patients. Other categories of antidepressants include atypical, which are stronger antidepressants that can have narcotic effects, and tricyclic, which are known to have more serious side effects. More than likely, psychotherapy will be recommended to patients, a type of therapy that provides emotional support for patients. Although it depends on the severity of the depression, therapy will usually be scheduled several times a week. Medication is normally taken daily and can actually have adverse effects if it's cut off prematurely. If the patient is observed to have suicidal thoughts or tendencies, hospitalization may be required to prevent harm. Throughout hospitalization, patients can continue to administer medications and therapy in a safe and controlled environment until it is deemed that the patient can continue treatment independently. If medication does not seem to be working, there are alternatives, including electroconvulsive therapy, which uses electrical currents to create balance between neurotransmitters in the brain and provide immediate relief in emergency situations. And there's also transcranial magnetic stimulation, which is an intense brain stimulation treatment.